Hi, this is Dr. John Grazel, and this is another in our synopsis on our course on international development. And actually, now we're going to have two sections on health and international development. And the reason we're having two is because uh, health presents us with a very interesting contradiction, what I call very often the good twin, the bad twin, or the yin and the yang. Or the triumph and the despair. And what do I mean by that? First, we're going to look at health as one of the most successful, important, and actually most potentially useful of all interventions. But we're also going to look at it afterwards at terms of its problems and its challenges and the perplexities that faces today and why we're not doing better, and in fact, why we may be actually going backwards. So let's start with the first thing. Let's start about with the good twin. Um, we define the foundational principle of development for our course as systematic cooperation in a sustainable and equitable fashion. And I think the case of health is a perfect example of when you have that, you have success. Now, the real triumphs in health didn't begin with international development. They actually began at the latter part of the 19th century, not only with the advances in understanding disease, but particularly with sanitation and other related public investments in health. Uh, it was good sanitation, the beginning of understanding that you had to have clean air, the beginning of understanding that you had to have some safe food. These public health measures that really resulted in this dramatic reduction in particularly child mortality that characterized the beginning of the 20th century and set the world off in a population expansion that, as we discussed in agriculture, should have made Thomas Malthus' prediction that the world was going to starve true, though it didn't. Uh, then you did get another tremendous surge right after World War II with international development. You got a concerted series of efforts that were really quite spectacular in the effects they had on reducing particularly child mortality and even maternal mortality. I just want to, there's so many of them, I just want to focus on three as examples. And as examples of the tremendous successes in international development. One was the eradication of smallpox. Smallpox, a scourge that has always been part of humanity's history, and yet, in fact, no longer is even considered a threat in the world today. And the reason was that there was a concerted effort in the late 60s, early 70s to basically wipe out smallpox from the world. And it was done through the World Health Organization, the association of many different nations, the mobilization of everything from health personnel to Peace Corps volunteers to local health workers to basically track down every case of smallpox. And by eradicating that, eradicating the host for the smallpox virus and basically removing it as a scourge of humanity. Just an enormous testimony to the power of cooperative, systematic uh, approach to health. Now, another one, which is very different but very interesting, is called oral rehydration therapy. Why smallpox has always been a scourge. In fact, if you look at the greatest killer of children, it's almost always been diarrhea. Diarrhea can come from many different causes, from a serious disease like cholera to just food poisoning to a series of other causal factors. But the fact is that diarrhea in a young child results in rapid dehydration, the loss not only of water but of salts, and eventually quick death. But in fact, that can be, in most cases, dramatically treated and reversed simply by giving fluids, which means not only water, but water with sugar and salt and potassium to replace the lost electrolytes. And as long as you keep filling the child with fluids, you basically can compensate for the loss of fluids through the diarrhea until the acute phase is over. And one of the most dramatic examples of successes in international development was the introduction of oral rehydration therapy, where they developed very small packages that had powder that basically had the salt, potassium, regular salt, sugar, and the training of ordinary women on how to mix that into solutions and feed it to their children. And in many cases, setting up special programs such as women in different villages who would put flags on their houses to indicate that they knew how to do oral rehydration therapy, and a mother could come and get their help. And this simple intervention was a major, major advance in reducing child mortality around the world. Then, of course, there's the whole story of vaccinations per se, and how vaccinations have dramatically reduced a whole series of deaths, from polio to measles. Again, these are major activities that took what I call public health approaches. They didn't focus on individuals, they focused on a large phenomenon that repeated itself, and the approaches that were given were approaches that mobilized elements of society to establish systematic, cooperative ways of dealing with this problem for everyone who basically was affected with it. Afterwards, just education itself began to be emphasized. And one way education particularly demonstrated its power was in the reduction of population, because it was clearly shown that as you educate women, not only because they're educated, but also because they become economically more productive, that reduces a dramatic decrease in population size. And lastly, in terms of education, we can't talk about health in the world and not talk about HIV/AIDS, which at one point we thought was potentially could wipe out half the world again. A most unusual situation, because of all the plagues of humanity, here was one that in fact was almost entirely addressable by behavioral change, and behavioral change through education. And in fact, what we discovered was that some of the most successful approaches in countries such as Uganda was precisely education. And it's not education just about abstinence, which got a bit of a political storm going in the world. It was about education about why it's important to be tested, to know whether or not you have it. Because if you don't test yourself, you don't know really whether you should face the medicine and do something about it. It's about education about how the community can help a person or a family who's suffering with somebody from AIDS, how nutrition can play a role. So education actually came to the forefront as being one of the most effective ways of addressing the HIV/AIDS epidemic, and could have been and still could be much more successful, because we have still an absolutely intolerable situation in places like Washington, D.C., far worse than countries in Africa, because we're not doing what we should in terms of education, behavioral change. But it can be done, and there was a lot of success in this regard, and there actually should be more investment in this regard. But the fact that the world isn't entirely suffering from HIV/AIDS is another success of certain efforts of international development and healthcare. And then, health can have even secondary effects that are actually amazing. In the Congo, in the middle of fighting, there actually was a truce that was declared for 3 days by all the sides, in which everyone participated, including soldiers fighting on different sides, on getting out there and vaccinating children against polio. So what we see is that since international development, and even before it, there has been dramatic advances in health, and health directly translates into everything from increased economic productivity, reduced suffering, increased levels of education of women, smaller child size, what would seem to be a win-win solution across the board. So should we put more money in it? Should we do more? The answer would seem to be yes, but then there's another side of that story, and that's what I want to discuss in the next tape.